host, Anthony Taylor, back with you again. We have been off for a while, so it's always good to be back with you. It's good to be back here with Kim on Minneapolis 360, always trying to bring you really good information from the city of Minneapolis perspective to help folks make educational and rational decisions about everything that's important to community, to family, to everything. And today is really an important topic that I have two great people to speak on that topic about vaccinations. So there's been a lot of conversations around vaccinations. There's been talk around COVID vaccinations. There's talk about flu vaccinations. A lot of those things has been in the conversation. We already know we're in the midst of flu season, so we'll get into what flu shots look like, some of the information around where you can get a flu shot, and just really anything that we can touch on to bring that to light. And also the controversial topic around COVID-19 vaccinations. And if you've been reading things and you've been getting on your social media and you've been watching the news, there's a lot of talk about what that looks like and what's coming forward. So I've got two perfect people to talk about that as well. But also, too, after the vaccination conversations, we're going to talk a little bit about the census, right? There's been some updated breaking news around census that I really want folks to know and understand because things have changed. And I think maybe a couple of weeks ago on the show, we had till October 31st to be able to fill the census out, and that is not the case. So please stay tuned as we go forward to learn about the new breaking news on census. But without further ado, I want to bring in our guest to talk about vaccinations. I have Catherine Harrison from the Minneapolis Health Department, and one of my friends and biggest fans of her work. I'm a big fan of her work, April Graves from the Office of Violence Prevention. She does beautiful work throughout the city, and I'm grateful to both of those ladies to come on the show. Welcome to Minneapolis 360.
Hey, ladies.
Catherine.
Thank you. Thank you, Anthony.
Thank you, Anthony.
Okay, I hope I wasn't too long-winded and y'all left the conversation. So I just wanted to make sure y'all was good. So, Catherine, I want to start with you. Just tell us a little bit about what you do in the health department, and after that, April, can you tell us too as well?
Yeah, absolutely. Thank you so much. I'm glad to be here today to talk about all these important issues. So, I work in the health department's emergency preparedness program. That is the part of the health department that is responsible for making sure the 100 plus awesome staff in the health department are ready and willing and capable to respond to a health emergency, whether that is something like the Drake fire that happened on Christmas, which feels like forever ago, to the current pandemic, or years ago when a tornado came through on the north side, when the bridge collapsed. All of those emergencies either have health impacts or are themselves a health emergency. So part of my job is to make sure that our staff is ready to jump into action and respond to those situations. So, and then in the current pandemic emergency, I'm kind of all over the place, trying to just support our staff in all the really challenging and hardworking roles they're working on. So that's my background and what I do every day at the health department.
Thank you, Catherine. April, tell us about what you do.
Thank you, Anthony. I'm excited to be on the show again today as well. I usually work primarily on teen dating violence and youth violence prevention through the Office of Violence Prevention, which is also housed within the Minneapolis Health Department. And my focus is really on North Minneapolis. I work with athletes at North, at Henry, at Edison, and I've also worked with some athletes at Cooper High School, as well as some summer sports leagues, run and shoot. I've also been in partnership with the Minneapolis Youth Coordinating Board's outreach and engagement team, so the yellow shirts that say youth are here, that provide sort of informal conflict resolution, are caring adults to young people in the community, and an avenue to resources for young people, whether that's a job, housing, after-school activities, or just, a a friendly ear to talk to. This year, especially, I've been focused a lot more on response to the COVID-19 pandemic. I've led some work in collaboration with Anthony and others through the Neighborhood Community Relations Department within the city to focus on the most impacted communities and trying to make sure that community voice is part of our response to the pandemic. And I continue to do work on COVID-19 and vaccinations in collaboration with Catherine and others within the health department. And thank you again for having me on the show.
Absolutely, April, and thank you too as well, Catherine. So let's get into it, right? So we're talking about vaccinations. So there's a couple ways we can go with vaccinations, right? With the flu shot, with COVID. But Catherine, I'll start with you. Typically, what should folks know generally about vaccinations, especially during a pandemic? What should parents know really? Because we're really talking about the flu season as we approach that now. So tell us what folks should know about vaccinations.
Yeah, that's a great place to start. So I think one of the first things I would say is that overall vaccinations are one of the best investments we can make in our health. We know that to be healthy, we need so many things, clean air, fresh food, spaces to move our bodies, safe housing. And vaccinations are right up there with something that step we can take to protect our health. And that's even more important than ever in a pandemic for a few reasons. The first is that there's been a lot of disruptions in healthcare and other systems. And so making sure that we stay as healthy as possible to limit the impact on the healthcare system and limit the fewer reasons that we have to get in contact with the healthcare system, sometimes the better, especially when there's a pandemic going on. And as, making sure that we're not susceptible to other diseases, especially because COVID looks a lot like the flu, can help, if we do get sick, to rule out kind of what it could be very quickly. And so for parents, it's probably really important to note that we have seen a drop in some of our childhood immunizations since the pandemic started. So some of those child vaccines, pertussis, polio, hepatitis, all those kind of regular vaccines that are really important for children to get. We've seen a decrease in those being either available or because people are not going to the doctor as regularly and trying to stay home, stay away from the healthcare system. And so it's really important for parents to remember that that's a big step to take with your kids' health. And I know that it's also the pandemic. A lot of people have lost their jobs. Maybe they've lost health insurance or there's been some change in their health insurance. And in Minnesota, we're really blessed to have a great program called Minnesota Vaccine for Children that works hard to make sure that all kids have access to vaccines regardless of cost or healthcare access. So those are some of the really important parts that I hope parents remember and know and that we all take to heart for vaccinations right now.
Absolutely. And maybe too with some of the decrease is just that folks aren't going to school, right? So parents may think that just their students or babies aren't going to school, that they might not need those vaccinations too. So again, and this is just a guess. I'm not an expert in that as well, but I want to bring April in. So April, right? So we're talking about the flu shots this year. Give us more information about what we should know about a flu shot.
Well, health experts recommend that you get a flu shot in September or October of this year. It usually takes about 2 weeks to start protecting you, so you should make a plan to get it soon if you haven't done so already. Each year, the flu shot is formulated to protect you against the most common strains for the upcoming flu season. That way, if you catch a strain of the virus that's not part of the vaccine, you may still have some protection against severe flu. It's one of the major reasons that people go to the clinic or emergency room in the winter. So in a regular year, hundreds of thousands of people are actually hospitalized by the flu. So getting your flu shot can help keep you out of the clinic or hospital, which could free up more resources to deal with the COVID-19 pandemic. So not only would you be protecting yourself, but also helping with the capacity of our healthcare providers to protect other people.
We are with Catherine Harrison and April Graves. Catherine is with the Minneapolis Health Department. April is with the Office of Violence Prevention. So, like, who should get a flu shot, right? So I've heard people talk about, well, babies should get the flu shot, and people talk about, well, some of our seniors are really the most important people that should get the flu shot. Who should really get the flu shot, Catherine?
Yeah, that's a great question. It has an easy answer, and anyone who can get a flu shot should get a flu shot. So that means anyone 6 months or older, and that 6-month age is not because we don't want babies to get vaccinated or we don't care about protecting babies. We absolutely do. It's just that there are no flu vaccines approved for anyone under the age of 6 months. The good news is that in pregnancy, pregnant women who get a flu shot, that protection passes through the womb to their babies and can protect their babies for a few months after they're born. So pregnant women should absolutely get the flu shot. Anyone over age 65 should especially get the flu shot, and there's actually a high-dose flu vaccine for older folks. Anyone and everyone, because there are some people who can't get it. So the more of us who do get it, even if we think we're healthy and we're not in a high-risk situation, that helps protect the rest of our community. So anyone who can get it should get that flu shot.
So I'm going to play devil's advocate for a second.
And I knew you was going there too. So go ahead. I'm waiting for it. I love it. Go ahead.
You always hear. I hear a lot of times people are like, "Well, I'm not going to get the flu shot because I feel like the people who take the flu shot end up getting the flu, and I don't take the shot and I never get sick." Is that a myth?
Yeah, that's a great question. So, all these are so good questions. And I really appreciate you jumping in with that, because even myself, I'm a nurse. And
right.
Sometimes I'm like, oh, do I want to,
Yeah.
And my mom, every year, she's like, not doing it.
Right.
So there's two kinds of flu shots. Theoretically, with the live weakened virus, you could get it.
Mm-hmm.
Very, very rare. The flu shot itself is a dead virus, so you cannot get the actual flu. But the way the flu vaccine works is by kind of like many vaccines, sort of making the body think you have the disease, mm-hmm. so that it builds up an immune response. And sometimes in that immune response, you can get symptoms that look like the flu. But it is, even if you feel like you have it, it's less deadly, less severe. I mean, I had the flu 2 years ago while I was pregnant with my daughter.
Oh, wow.
I had never been so sick in my life. I was so scared. It was awful. And that it's just, feeling like you have it from the shot versus actually having it. Okay. There's a difference there.
Gotcha.
So that's, but it can definitely feel not great. To those 2 weeks that it takes that you mentioned to mount that immune response can sometimes be not very fun, and people will feel like, oh, now I got the flu shot, and now I've got the flu, but it is different.
So it is kind of true where they say, well, they're injecting the flu into you, so that is more or less the truth. But you, as you said, it's putting it into you so that you can build the your immunity can build up to be able to fight against getting it any time after that. Exactly.
Yeah, we take pieces of the virus, just little parts of it, to kind of trick the body into thinking and making up a response to the disease itself. So, yeah.
Got you. That's interesting.
Yep, and Kim, and that's a great question. I knew you were going there because we had a conversation about this previous, right? Yeah, and we talked about some of the misinformation that's out there that we sometimes believe, and it's not true, right? So it was great that you asked that, and Catherine answered.
Thank you for clearing it up. Mm-hmm.
Absolutely, because sometimes we listen to the wrong people, right? And sometimes just because our uncle, had a semester of college, and, think he,
right. He
think he knows everything, right? Yeah. April, where can folks get a flu shot?
Well, your regular healthcare provider should be able to provide you with a flu shot. There's also multiple places like pharmacies, retailers like Walmart and Target, and dentists frequently also have flu shots available. It's also possible that your employer may offer you a flu shot clinic. But there's also a website through the Minnesota Department of Health that lists vaccination resources, and including ways to get affordable vaccines if you don't have insurance. So you can visit www.health.state.mn.us/people/basics/vacfinder.html, or just Google State of Minnesota Vax Finder, which would probably be a lot easier than remembering all of that link.
Absolutely.
There will be some free flu shots and COVID tests at Phelps Park, 701 East 39th Street this Friday, October 16th from 1 to 5. You can bring your insurance card if you have it. It's free if you don't have insurance, and there will be Spanish and ASL interpreters will be available. So you can register on site.
And
Just a couple options.
Yep, that's a great point, and like you can Google everything, right? There's a lot of slashes in that link, right? But Google State of Minnesota Vax Finder would be a lot easier too as well. So now we talked about the flu, right? And we kind of got that and addressed that, so folks know that it's recommended that everybody who can take a flu shot take a flu shot, and I think that's been around forever. I want to shift the conversation into COVID-19 vaccination, right? So we know that there's been conversations in this country and actually around the world really about vaccinations and what that looks like. And to be honest, there's a lot of nervousness and trepidation about COVID-19 vaccination. So I want both of you to kind of chime in on this. So whoever wants to go first, fine. But I really want to hear both of your points of view around COVID-19 vaccinations. And I'll kind of add a little bit of what I feel about that. You too as well, Kim. Tell us what we know about vaccinations, because there's a lot of things going on. There's a lot of different companies doing clinical trials in different phases, and I'll let you guys talk about it because you're more the experts. Just tell us what we need to know about what's going on with COVID-19 vaccinations.
I'll take a crack at that first, Anthony. First of all, I think it's totally understandable that people have concerns about a COVID vaccine. I mean, given some of the historical context, especially within communities of color, it makes perfect sense. And I share some of those concerns as well as an individual and as a mother. The public has also received a lot of conflicting information about when the vaccine will be available. It's been politicized. And it's being developed more quickly than any vaccine in history. So it's understandable that there would be a lot of concerns, fears, and misunderstanding about the conversation. And I anticipate that a lot of the work that's going to have to be done will be building trust. Some of that will be happening through the Food and Drug Administration's strict standards for vaccine safety, including 3 rounds of safety trials that use diverse groups of people, so that by the time that it gets to the phase 3 trials that are complete, tens of thousands of people will have received the vaccine already. And if there are any serious side effects, even in a small number of people, the trials would be paused. So that could maybe, give us a little bit of peace of mind, but I'm sure that there's still a lot of work that will have to be done to make sure that people have enough information and that are able to have trusted leaders to guide them within that process of getting vaccinated. But once the vaccine is approved and becomes available, your doctor could also tell you if there was any safety concerns that you should be aware of. And I'll turn it over to Catherine to add anything else.
Yeah, thank you, April. I think you summed a lot of that up really, really well. The only thing I would add is just that, this is a group effort in so many ways. I think we're definitely seeing impacts of kind of an unprecedented time with relationship between politics and science. And I think a few things that are helpful to know is just that there are a couple of different players in the mix when we think about vaccines. So there's the Food and Drug Administration, which ultimately approves a vaccine and licenses it. But there are other independent boards, the Advisory Committee on Immunization Practices, the National Institutes of Science and Medicine, different groups that also have opportunities to influence and uphold the long history of, as April mentioned, very strict safety requirements. And so I think there's looking to those folks, and they have been vocal. There's also a big community of physicians and scientists who are very well aware of the political pressures around this vaccine and have pledged to kind of speak up if the data isn't good, if the evidence isn't there. The fact that we are hearing about trials getting paused, so the Johnson & Johnson trial was just paused, the AstraZeneca trial has been paused. So in that case, also, a free and open journalist society, kind of free and open media and journalism that reports on these things, that brings them to light, that there's just transparency, are all spaces where everyone plays a role in building that trust. And then we in public health too, kind of having to hold both some honesty about our own history of, whether it's negligence or actual malfeasance with, care, and balancing our efforts to improve that and to build trust, more recently in our history. So takes us all,
Absolutely. We're with Katherine Harrison from the Minneapolis Health Department, April Graves, Office of Violence Prevention. And I want to go back to something you said, April, and you're absolutely 100% correct on everything you said. And I just want to touch on it, the fact that this is being politicized, as well as masks. And we talked about this the last time on our show about masks being politicized around this pandemic. But also, too, what makes me nervous, and you touched on it too, and I would assume most folks are nervous as well, is that the atrocities that have been taking place on African Americans throughout history with vaccinations gives me pause around taking vaccinations around COVID. I mean, there's been atrocities that are happening throughout our history as Black folks. In dealing with things like this. And then there's also misinformation around the COVID-19 vaccination, but people's perception of their reality, especially when you talk about some of the things that historically we know that has happened in our country. And when you talk about building trust in the health department and any health department or any organizational department around this country that is trying to push out vaccinations, some of those things have to really be acknowledged first, right, before we get started. Do you two ladies agree on that?
I do agree. I think that, not addressing the very real elephant in the room only serves to make people feel less trusting. Just like, acknowledging that racism exists, you have to be able to name things before you can really work on them. So I agree with you 100%, Anthony, that we have to talk about that. We have to be blatantly honest about that history. Otherwise, we're not going to be able to build the trust to actually work together and fight the virus the way we need to.
Yeah, I would absolutely agree as well that's acknowledging that, having those conversations, kind of having both reckoning and reconciliation, and then from there, again, holding both of those at the same time of, here is this history, what have we learned from it, there's also continues to be, as April just mentioned, racism impacts health care daily, whether it's through social policies or actual health care delivery. So kind of holding that continuous improvement and striving for better while presenting the best, most honest, clear information about we know about something, and then remembering our central creed in healthcare is that the patient is autonomous. People can make their own decisions, and we have to do the best we can and then let them decide how they feel about that and what action they want to take.
And I appreciate you both chiming in on that as we run up against the clock here. I want to shift to just really the COVID-19 upcoming testing events. Can either of you tell us what's going on in Minneapolis around COVID testing that's happening?
Yeah, Anthony, I can do that. Minneapolis is offering some free COVID-19 testing at some upcoming events. We've done several over the last several months, but here's a look at the ones in the next couple weeks. There'll be an event at the mosque on Lyndale, 1729 North Lyndale Avenue from 10 to 1, Thursday the 15th. That's tomorrow. There'll be some Somali interpreters available, and you can also register on site. Also at Phelps Park, 701 East 39th Street from 1 to 5 p.m. tomorrow, Thursday, October 15th, as well as 1 to 5 p.m. Friday, October 16th, with flu shots available on that day. We mentioned that earlier in the show. There'll be Spanish and American Sign Language interpreters available. You can also register on site at that event. There'll also be an event at St. Peter's AME Church at 401 East 41st Street. That's 2 to 6 p.m. next Thursday, October 22nd, and then 2 to 6 p.m. Friday, October 23rd. For this event, they prefer that you pre-register, and you can register, but you could also register on site if necessary. Although these events focus on particular communities, all are welcomed, and tests are available to people arriving on foot or by car. You can expect to get your test results from that day in about 2 days. So those are the ones that we have coming up.
Is there a way that folks can? Is there a way, April, that folks can get this online anywhere? These information about with the testing sites.
I believe they've been shared on some platforms. Go ahead.
Oh, sure. Yeah, I was just going to jump in and say the communications department has been posting these on the Minneapolis coronavirus website. So that's if you Google City of Minneapolis coronavirus or COVID, there's a page that has all of these listed. I think they're doing some social media pushes, but definitely the www.minneapolismn.gov/coronavirus, I think, is the page, should have all of these listed, and they're working on keeping that up to date.
And these are free, so that is great for folks, and all are welcome. So that's a beautiful thing. I want to thank both of you for coming on today with this great information. I really foresee more conversations down the road on this show. I know there's a lot of things in place and plans that are happening for more community conversation, but I really think as we move forward in 2020 and 2021, that this is something that we really need to kind of dig into going forward. So I'm glad that both of you were on to be able to start the conversation. So thank you for coming on the show today.
Thank you so much for inviting us, Anthony.
All right. Thanks, ladies.
You have a blessed day.
You too.
That was Captain Harrison and April Graves talking about vaccinations. Real quick, Kim, what's your thoughts about what you heard today?
Well, I you know what? I'm just happy that they cleared up a lot of misinformation, and just that they, just talked about, how the virus affects us and who all should receive it. So I think it's important. Of course, since we were little, or since I can remember, we've always had to be vaccinated for different things, especially with going to school. Mm-hmm. So I still feel that it's important to take the vaccination. Now, I don't know. I'm still, with the flu shot, I'm still kind of up in the air. But, I mean, I used to take it, but then I do feel like, I have not taken it, and I haven't got the flu. So I don't know.
Right. Yeah. I will tell you, I'm extremely nervous and anxious around the COVID-19 vaccination.
Right.
So I can't wait to learn more. And I think, absolutely. I mean, our folks nowadays don't get their information from, CNN or the typical, news channels that are out there. So a lot of our information is coming from different sources and places that may not give the best information. Right. So I really want to dig in, and as a city of Minneapolis, we'll be able to dig in more around the COVID conversations. But I will say that I'm definitely nervous about that, and I think most folks
will be as well.
will be as well. Absolutely.
Yep. But we appreciate you for bringing this information because it gives people the option, and at least they know, they can make their decision on what they want to do because they have all the facts.
Absolutely, and that's the most important thing. When you're informed, correctly, you're able to make better decisions.
Absolutely.
Absolutely. So I got about 30 seconds left, Minneapolis. I just want to talk briefly, real quick, about census. So the Trump administration got a court order for the end of the census starting tomorrow. So there's been some back and forth battle with Trump and the federal government around census. There was an extension that was supposed to be October 31st. We had talked about that on the show. There was a court decision that says that Trump now can end census tomorrow. So if you have not filled out the census, if you know folks who have not filled out the census, please contact them and tell them to go to my2020census.gov or call 844-330-2020 to be able to fill out the census information. So tomorrow is the last day. We do not have until the 31st. And we all know, we've talked about this several times on the show.
Don't be counted out.
Do not be counted out, right? So please, tomorrow's the last day. Get on the website, my2020census.gov, to be able to fill out the census if you have not, and please tell somebody else.
Yes.
So thank you, Kim, as always. It's always good to hear your voice.
Same here, bro.
Have a great day.
You as well.
Goodbye, Minneapolis. See you later.
All right, on the way is Mr. Loudmouth himself, Zany K, right here on 89.9 KMOJ, today's R&B and Throwbacks.